Acuity Hypnotherapy presents HYPNO-BAND Weight Loss System, the world's #1 gastric band hypnotherapy system. Obesity is a disease. Australia is today ranked as one of the fattest nations in the developed world. The prevalence of obesity in Australia has more than doubled in the past 20 years. Obesity in Australia. 14 million Australians are overweight or obese. More than 5 million Australians are obese. If weight gain continues at current levels by 2025, close to 80% of all Australian adults and a third of all children will be overweight or obese. Obesity is a disease. Obesity has overtaken smoking as the leading cause of premature death and illness in Australia. Obesity has become the single biggest threat to public health in Australia. On the basis of present trends, we can predict that by the time they reach the age of 20, our kids will have a shorter life expectancy than earlier generations simply because of obesity. Secondary complications. More than 900,000 Australians suffer from diabetes. Aboriginal and Torres Strait Islander Australians have the fourth highest rate of type 2 diabetes in the world and are 1.9 times as likely as non-Indigenous Australians to be obese. Secondary complications. Australians reporting heart, stroke, and vascular diseases aged 15 years and over were much more likely to be classified as overweight or obese than those without heart, stroke, and vascular disease. Health disorders in children like type 2 diabetes, high blood pressure, asthma, hypertension, and sleep apnea can be directly attributed to childhood obesity. Secondary complications. Cardiovascular disease, diabetes, and chronic kidney disease account for approximately a quarter of the burden of disease in Australia, and just under 2/3 of all deaths. These three diseases often occur together and share risk factors such as physical inactivity, overweight and obesity, and high blood pressure. What causes obesity? Obesity develops when energy intake consistently exceeds energy output. Complex disease involving genetics, physiology, metabolism, appetite regulation, environmental factors, and psychological and cultural. Why lose weight? Feel better. Quality of life. Look better. Be healthier. Avoid discrimination. Live longer. Medical problems from obesity. Many medical problems are caused by or worsened by obesity. Most get better or go away with significant weight loss. These medical problems are called comorbidities. Obesity comorbidities. High blood pressure, diabetes, high cholesterol, high triglycerides, heart disease, joint pains, difficulty breathing, sleep apnea, heartburn, urine incontinence, varicose veins, difficulty exercising, fatty liver, increased cancer risk, frequent headaches, and sex hormone problems. Morbid obesity. 45 kilograms over ideal body weight, body mass index of 40 or greater. 36 kilograms over ideal body weight if causing significant comorbidity. Body mass index of 35 or greater if causing significant comorbidity. Treatment options. Diets, exercise, behavior modification, medication, surgery. HYPNO-BAND Weight Loss System, the world's #1 gastric band hypnotherapy system. Diets don't work. Almost anyone can lose weight dieting. Almost no one can maintain long-term weight loss. 97% of patients 100 pounds or more overweight regain lost weight within 2 years. Often gain more than was lost. Exercise. Very important as part of any weight loss program. Regular exercise causes more weight loss and keeps it off longer. Length of time is more important than intensity, rarely enough as treatment alone. Medications. Cause only modest weight loss, 10 to 15%. Need to be taken indefinitely. Often cause side effects. Expensive and often not covered by insurance. only work well in combination with diet and exercise. Surgery. Obesity surgery is the last resort when all other attempts at weight loss have failed and the person's health is at risk. Current techniques include gastric banding, lap band surgery, gastric stapling, jaw wiring, and bowel bypass. Calculating your body mass index. There are various ways to categorize the degree of overweight and obesity. A popular and easy method is the body mass index. This should only be considered as a guide. To calculate your BMI, divide your weight in kilograms by your height in meters squared. The resulting figure is your BMI. Calculating your body mass index. A person with a BMI of 40 or more is at a much higher risk of suffering from obesity-related disorders, such as diabetes, reduced mobility, or high blood pressure. The categories are as follows: less than 20, underweight; 20 to 25, normal weight range; 25 to 30, overweight; 30 to 40, obese; 40 to 50, morbidly obese; more than 50, super obese. Surgical lap band system. Gastric stapling and gastric banding involve procedures where a small pouch is formed at the top part of the stomach. This allows only a small amount of food to be consumed at a sitting. Surgical lap band system. This results in a feeling of satisfaction and the loss of hunger after a small solid meal is eaten. If more food is eaten in the next hour or two, an overfull and bloated feeling will be experienced and regurgitation may occur. Stomach stapling. Stomach stapling is usually done through an abdominal incision, while banding can usually be done with laparoscopic or keyhole surgery. Banding has the advantage that it can be adjusted if there are problems with eating. The band can be loosened by an injection through the abdominal wall, or if insufficient weight is lost, the band can be tightened. Stomach stapling. Both operations may result in early complications such as infection, leakage from the stomach, thrombosis or embolism, or even death, although these are fortunately uncommon. In the longer term, staple lines can break down or the band may slip or become infected. Both operations are reversible. Complications. Band slippage 3 to 5%, band erosion 1 to 3%, tubing leak 2 to 3%, port infection 1 to 2%, stomach perforation 1%, esophageal dilation, and death. What is the HYPNO-BAND Weight Loss System? The HYPNO-BAND system is a combination of cognitive behavioral therapy and hypnotherapy techniques that help you explore, analyze, and change your eating habits. Then, using the mind-body connection, we fit a virtual gastric band to your stomach, helping you to eat less and less often. Does it involve surgery? No. The HYPNO-BAND system is a non-invasive behavioral changing method using the techniques of hypnotherapy and cognitive behavioral therapy. Questions. Does it hurt? On the contrary, the HYPNO-BAND procedure is extremely relaxing and pleasurable. Are there side effects? No, there are no known side effects associated with undergoing this procedure. Questions. So it's safe? Yes, the HYPNO-BAND system is perfectly safe. Will I be under the hypnotherapist's control? Never. No hypnotherapist can make you do anything you do not want to do or make you behave in a way you would not normally behave. Questions. Am I suitable for the HYPNO-BAND weight loss system? If you are overweight and really want and are committed to losing weight, then you should be suitable. The only exception would be if there is a psychological reason for your weight problems or if you're taking certain medications. Your suitability will be assessed at the initial session. Questions. Will it work for me? The key to success is you. No weight loss system will work unless you are committed to losing weight. You must be prepared to change your eating habits and lifestyle. If you are totally serious about losing weight, then it will certainly work for you. The HypnoBand system provides you with the tools and ability to lose weight and maintain a healthier body. Questions. Is it guaranteed? Like any medical or therapy procedure, there can be no definite guarantees. Even a surgeon cannot guarantee that an actual gastric band will work. It should be noted that it is you who holds the key to losing weight. No system will work if you're not 100% committed. Questions. Is it guaranteed? The mind is a very powerful instrument, and by using the HypnoBand system, you will have the tools and power to change your eating habits. The only way to lose significant amounts of weight is to eat less. The HypnoBand system helps you to change behavior and lifestyle, which in turn provides you with the ability to lose weight and stay that way. HYPNO-BAND Weight Loss System. The HYPNO-BAND Weight Loss System is extremely cost-effective when compared to other methods. Whilst gastric band surgery can cost many thousands of pounds, and even belonging to slimming clubs adds up after a time, HYPNO-BAND saves you money not only as a way to lose weight but in your weekly food bills. By using our system, you will eat smaller portions and eat less often, cutting your food bills in the process. Questions. What do you get for your money? The HYPNO-BAND system comprises a series of 1-hour sessions plus CD or MP3 recordings which you use for reinforcement. A full dietary and medical history will be taken and an initial assessment done before commencing. Also, in the first session, you will be introduced to hypnosis and experience the fantastic feelings of relaxation and calmness which results from being hypnotized. Questions. What do you get for your money? We will also begin your journey to losing weight. In the second session, you will encounter the HypnoBand, and we will begin the process of having the virtual gastric band fitted. Questions. What do you get for your money? In subsequent sessions, the HypnoBand virtual gastric band will be fitted and adjusted. In later sessions, the process will be reinforced and you will learn a different way of eating. Following the sessions, you should use your CD or MP3 to back up and reinforce the work you have done. Acuity Hypnotherapy. Contact us today for a free, no-obligation chat to see how you can benefit from weight loss hypnotherapy at www.acuityhypnotherapy.com. Acuity Hypnotherapy. Aspire, focus, achieve. Acuity Hypnotherapy, the home of the HYPNO-BAND Weight Loss System in Melbourne. The world's #1 virtual gastric band hypnotherapy system. www.acuityhypnotherapy.com